Started. Oh, thank you, Joy. But welcome to Advocacy in Action, December 2022. The holidays are almost upon us, so I'm excited to get home and see some family, and I hope y'all are excited to enjoy yourselves as well. Hi, Ralph. I wanted to take this session to kind of go through some updates on So Kids Can Move. There's been a lot of exciting movement on this initiative in the past couple of months. It's been moving very fast, and so got a lot to share. And then there's also a few kind of behind the scenes state work that we've been doing at AOPA that I'd like to share. And after that, I can kind of open the floor up and see if anybody wants to discuss any kind of state level legislative or regulatory advocacy in general kind of priorities that they have going into 2023 that AOPA can kind of focus on or direct our efforts towards. So in terms of So Kids Can Move, I'll start off with New Mexico. This is the state where a lot of things have been happening recently, and Nicole, if I forget anything, let me know, because there's a lot going on for sure. So last month, the AOPA team, we met with State Representative Liz Thompson. She's a physical therapist by trade, and she's the chair of the Health and Human Services Committee. She's very interested in our initiative, and she plans to introduce the legislation during next year's session. We have a patient champion named Kyle Stepp, who is really leading the way in the state, and we're providing him with kind of logistical support and things like that. He has several contacts at the New Mexico State House, and his kind of ground level on the ground intelligence, he says that the legislature would be receptive to covering activities for both adults and children. So this is going to be like an all ages initiative in New Mexico, and because of that, we've kind of rechristened it So New Mexicans Can Move. It's kind of more like a state level initiative name rather than kind of being exclusive of adults. We're going to be inclusive of all ages. And so Peter Thomas at the NAOP, he helped develop a draft bill. It fits into existing New Mexico statute, and Kyle and I are working with bill drafters who should be getting us a kind of a finalized version of the bill, or at least like a draft version of the bill, to be introduced by tomorrow, hopefully, or by early next week. And that'll be exciting to have that really, have it in words in a way that fits into the current laws in the state. And this support, it really isn't only limited to the State House. We met with the staff at the governor's office, and they're very interested in what we are doing as well. The governor herself hasn't offered that direct support yet, but we're confident that it aligns with the office's goals and kind of the executive priorities that have been going on in New Mexico. And next week, the partner organizations, advocates, partners, athletes who use the prostheses and their families, we're going to have a virtual kickoff meeting on December 21st. And we're hopefully planning to our legislative outreach efforts at that point to kind of discuss how to contact your legislator, what to say, kind of here's the fact sheet that we'd like to share, the legislative language that we can give to them to pass along to generate support. Also, this is something that happened in the past couple of days. Kyle also met with a senator, I think it was Gerald Ortiz-Pino, correct, Nicole? Nice. Okay, so he is also supportive of the bill, and he said that once the bill goes towards the Senate side, he will offer to be a champion. So that's really great news. We have a lot of support at the legislative level, and we're kind of working it at the governor's level as well. Nicole, is there anything else that you think we should add to that?
No, that was a great overview, Sam. I just want to give, kudos to Kyle Stepp. He's really been the one to champion this as above knee amputee just within the past couple of years, had osteosarcoma. limb salvage and used orthotics for a number of years. And then 2 years ago, he was on a downhill mountain biking course and crashed into a tree and shattered the metal that was in his leg, and became an amputee as a result of that. And Kyle has just been phenomenal leading this effort. I mean, not only is he a person with limb loss, but he's a very strong advocate, very articulate, and has a lot of connections within the legislature. So he's been able to rally some other advocates as well. Laura Lewis, whose daughter Callaway lost her leg in a rock climbing accident recently. And so we've got a lot of stories from kind of on the ground advocates that I think are really going to appeal to the legislators. And AOPA is planning to have on the ground presence in New Mexico in January, as well as the Amputee Coalition will be flying out there to support Kyle and Laura and anyone else that's going to be part of the committee hearings.
Absolutely. And then the hearing schedules are always kind of hectic, so it'll be really helpful to have that support from AOPA and the Amputee Coalition for Kyle and Laura and other advocates that are able to be involved in kind of in-person efforts. Moving on to our second kind of big state that we've been doing a lot of work in, it's Colorado. Jeff Kane, who assisted with passing the nation's first insurance fairness bill in Colorado a little while back, and the recently formed Rocky Mountain Orthotic and Prosthetic Coalition, they're doing a lot of great work on this. And Angela, please, I'll ask you at the end to make sure we've got everything covered. But Jeff has reached out to State Representative David Ortiz, who has also expressed interest in introducing this legislation. Typically, Colorado state reps, they can only introduce 5 bills per legislative session. And Ortiz has kind of largely already made his decision on what those bills are going to be, but there is a procedure in place that allows him to introduce kind of a 6th bill as like a kind of a bonus bill, for lack of a better term. And so he'll be hosting a meeting on December 20th to kind of outline his legislative agenda for the 2023 session. And the Rocky Mountain Coalition and Jeff Kane and ourselves, we're working to bring advocates to this meeting to push for support. Jeff recently sent a message to our team only a couple minutes ago, and he said we have 3 minutes to talk to Ortiz about this. So we're going to kind of take something together for that meeting. Angela, is there anything you'd like to add to that?
Hi, everyone. This is actually Emma.
Hey, Emma.
Angela sent me the link and it logged me into her account. She's actually at a physical doctor's appointment right now, so she couldn't make it, but Anna and I are on for her. Anna is our new practitioner in Boulder, and today's her first day, so she's just diving in with us. So we're catching her up to speed. But Sam, you did a great job covering everything. We just got off a call with Shanice Kehoe, and it sounds like they're going to help us basically lobby for this bill and send us some more representatives that we can contact to hopefully get behind this. So yeah, there's a lot of momentum going on. So fingers crossed, but it sounds promising. And thank you so much, Nicole, for all your help. I just saw the back and forth emails, and the fact sheet looks great. And yeah, I think we've got a shot at this.
Absolutely. And kudos to you, Emma, and great to meet you, Anna. And kudos to Angela Montgomery as well for all the work that you guys are doing on the ground to kickstart the Rocky Mountain Orthotic and Prosthetic Coalition. And really, I mean, Angela is going to be there in person next week with Representative Ortiz. And Jordan Simpson, who many of you might know her name, she was actually the one to first get this passed in Maine. And Jordan is now living in Colorado. And so she's going to be part of that meeting. So definitely have a dynamic team in place, and really exciting to see the ground effort that you guys have done. And Angela's also brought in a few individuals from the Center for People with Disabilities in Colorado, Dale and Craig. And I know that they will likely be instrumental to helping to push this forward too.
Yes.
Well, thank you. I appreciate the the further outlining Nicole and Emma, and welcome Anna. I can move on to some smaller progress we've made in other states. I think Colorado and New Mexico are the really big focuses that we've had recently with really big progress, but we're also working in other states to provide support and kind of generate that interest for future efforts. In Tennessee, the Jordan Thomas Foundation and Amputee Blade Runners are interested in getting involved. Their missions are very aligned with ours, and they have a state level and kind of a national network of patients and families that can be advocates for us. We've also been able to make contact with the Deputy Insurance Commissioner through Josh Southard of Amputee Blade Runners, and we've sent the model legislation to them for their review, and that'll be really helpful to get that kind of payer perspective on the bill to make sure we're covering all of our bases. And then outside of Tennessee, we've also been sending model legislation and fact sheets to interested associations and kind of groups of interested parties to begin generating support. That's happening in Utah, New Hampshire, and Illinois as well. And once there's kind of that level of interest and that kind of coalescing of advocates, we can kind of help provide support going into the most likely the 2024 session. We can kind of do that groundwork for a year to get a really strong coalition and make that happen. And then in terms of Washington and Oregon, this is where the So Kids Can Move initiative came from. That's kind of the genesis. We haven't had a kind of a central patient champion yet in those states. But we're continuing to kind of make contacts, build a coalition for the 2024 session as we're doing in other states. But I think what we've really found is having a Kyle Stepp in a state or a Jeff Kane or a Rocky Mountain coalition has been integral to really making that progress and in being able to know what's going on the ground and being able to make those connections that we at AOPA might not be able to see directly. Does anybody have any questions about So Kids Can Move? Cool. All right. So I can kind of talk about some other state level initiatives and advocacy work that we're doing at the moment. There's a bill in Texas right now, HB 134, that mandates coverage for cranial remolding orthoses in certain individual and group insurance plans, and it's also extended to Medicaid and Texas Child Health Plan program. We had a meeting with our cranial remolding orthosis intervention work group, some providers in the state, and a Texas State Rep Catherine Mize. We discussed kind of the bill's coverage criteria and advocacy strategy going into the legislative session next year. In Texas, legislative sessions are every other year, so you have to kind of time it out well to make sure that you're advocating effectively, since you kind of have half the time as other states to work on these bills while sessions are happening. We're kind of right now we're working on the coverage criteria. I've asked the work group and providers to send me their kind of edits of the legislation, and then I'll compile them and go with a clinician to see what suggestions we'd like to make to Representative Bernal, who is the sponsor of the bill. We're requesting a meeting with their office as well. Haven't had a lot of luck so far, just because I think it's towards the end of the year. I'm gonna call them after this call actually to see if they're around or their chief of staff is around. But we're planning on showing our support for the bill, trying to align advocacy efforts, and giving Representative Bernal our suggested edits to make sure that there is that kind of clinical perspective in the bill language. And that really, I was talking to Joe recently, and this really shows the benefit of the combination of kind of research, advocacy, and reimbursement that we've recently been able to accomplish by kind of consolidating that department, where we have the medical advisory board, our kind of advocacy team, and reimbursement experts all together with state reps, providers in the state, and all of these people are coming together to make this happen, and really excited to do that for other efforts in the future and to see what happens in Texas as well. In New York, we've been working with a coalition led by Matt Johnson at Hanger, who is trying to get some Medicaid reimbursement increases. And we met with them recently. The DOH mentioned they hadn't heard of a lot of access issues from patients directly. Oh, hi, Terry. They hadn't really, we told them there were access issues, but they said, well, we haven't heard anything. So we decided to try to gather patient stories and provider stories in the state. So we've developed an intake form that allows providers to share a form with patients, with other providers in kind of adjacent spaces, with business owners, caregivers, et cetera, to tell their stories of ease of access and coverage and reimbursement issues that they may have had. We've also included a QR code in this form so that providers when their patients are in the office can say, hey, if you want to scan this and provide your story, then you can do so really quickly. Hopefully we're going to be able to combine and compile these stories in a way that allows Matt Johnson to bring the stories together and talk to the Department of Health directly and say, here are all the times that people have been having issues. These are the stories that we have. And I think those personal, tales will be very impactful. And then finally, we have some work that we're doing in Mississippi. Currently, Mississippi Medicaid doesn't cover O&P patients above 21 years old. Chris Wallace, who's an AOPA member in the state, he's gathered together a group of providers to advocate for expanding this coverage to people above 21. He recently requested some scientific literature related to the kind of the financial impact and quality of life improvements related to covering O&P care, so that he can bring that information to Medicaid and hopefully advocate for change. Dr. Susanna Engdahl, our very own manager of health policy and research here at AOPA, she was able to conduct a pretty thorough literature review for Chris, and that'll hopefully get the conversation started with Mississippi Medicaid. We're also looking into other states that have done this in the past, that have done this, have been able to have this expansion happen. And so hopefully we can learn from those experiences, and if they have any data as well, we can compile that into one cohesive story that we can bring to Medicaid. I was talking to Ashley White at the Amputee Coalition a couple of days ago about this, and she said that this happened in North Carolina a couple of years ago. So I think I'll be reaching out to you, Dana, to see if you know anything about that. But yeah, we're kind of slowly getting all this information together for Chris. But in terms of state level news, that is all I have. That's everything from me. And I'd like to open up the floor now to see if anybody has any kind of specific advocacy topics that they feel are important to them and that AOPA should focus on or prioritize during next year and our advocacy efforts going into 2023.
Sam, you know that my request is still the same in trying to get prosthetic coverage for Medicaid participants that are in skilled nursing facilities in North Carolina. I went to the North Carolina, South Carolina meeting, and unfortunately not a single officer from North Carolina went to the meeting. So there was no business meeting. There were no new elections because I was hoping that with new leadership, we could kind of start from there. But as of right now, there is none. So I am going to take a little bit of my vacation time and try to come up with a game plan on getting some people together, because at the meeting I did meet several practitioners who are also concerned about that, as well as the reimbursement in North Carolina for Medicaid. And I don't know that we will go as far as like Rocky Mountain Coalition, but I think at least if there's a group of us that can work with AOPA, that maybe we can make some progress in 23 and 24 going forward, because I don't think I can rely on the association to spearhead those efforts.
Yeah, it's definitely, that's something that we have definitely talked about, Dana, and you please feel free to loop Joe and I in on this, and we're here to help. State level, like state and regional associations, it is a mixed bag sometimes, but we're here to help. And if there's any way that Joe and I can give you some contact information or help gather practitioners, that'd be great.
Yeah, Joe definitely gave me some of the history and information I can share with those practitioners.
Mhm.
I'm just going to have to do a lot of legwork myself and contacting people and seeing if we can get something started. I wish Terry would move to North Carolina and kind of whip things into shape here. But I will try to draw in her energy and vibes in the upcoming year and see if we can't get something done.
So, Dana, have you been in touch with the officers of the two associations just directly, or have you asked someone to connect with
and
them?
they will. Initially, they said that they could not wait for October to get here so that they could turn over leadership to someone else. And then they ended up not even going and even having an election. Since then, I have emailed them and asked them what their plan is to have a business meeting and to hold an election. And I have gotten crickets.
So I'll just share a little bit. In Minnesota, we've really put things on the back burner, and we meet on an as needed basis, really because of the pandemic. And we gather we have a national meeting, but it's run by the Northern Plains chapter of the Academy. So we hold the Minnesota meeting, and that's where we see each other, but there isn't any pressing need. So when something comes up, I just have an email distribution list and I send it out and I say, hey, this is the latest and the greatest. This is what I need. I need some money, or I need your vote, or I need communication. And we just work that way. So I completely understand how they've somewhat moved to the back burner. But I also appreciate the fact that you don't want to make a move in your state without your people, without the consensus. So I think maybe the next step might be to communicate directly with whoever is president and say, this is the plan. There's a group of us who have gotten together. This is what we'd like to do. And we'd like a letter of support from the North Carolina Association, the South, whichever one it is, and ask them if they would be so kind as to write a letter. And I would drop some names. I would say you're working with Sam from AOPA and Nicole from AOPA and Joe McTurnan, and see if that will get you in a headway, because then at least you're asking for their support. If they've done anything in either state, then the legislators know they exist. And when you start your process, they're going to ask, well, where are they? Where are your people? Like, you have a group, if it's a licensed group or an association that's already in, and you also might want to check if they're in good standing, because if they're not in good standing, then it's just a little bit of, it's just house cleaning that has to be done before you really take the next step. So does that help?
It does. And actually, for North Carolina, it is through the chapter, the Academy chapter. And they will say they're supportive. They just don't, they claim not to have the bandwidth to really put there. So that I am going to do exactly that. And as far as Medicaid's concerned, they honestly have not heard much from North Carolina since Ashley was in North Carolina as part of the association and got some things done. So we have some great relationships there. They just have gone silent, since Ashley's departure. So I don't think we're in bad standing with them. It's just a matter of getting back in
So
there.
when I say in good standing, I mean with your Secretary of State. Like you should look up the association's name, the legal name, and see if they're in good standing with the state, because that's the document that they need to update every year. And so you just want to make sure, and anyone can look that up. Go to your Secretary of State, plug in their name under a business lookup, and they'll tell you. So my guess is somebody's doing that each year, because we all get the triggers. Like right now, it's the end of the year. I have the triggers for making sure certain associations and my entities that I'm involved with are all, they remain in good standing. And it's just an annual check. I was going to say something else. Oh, it is not a bad thing that you haven't been back to North Carolina Medicaid in a while. They don't want us to bug them. They just want us to come when there's something that's needed, desperately needed. So, and if you have already created and fostered a relationship, or someone has in our community, that is easy to pick up. It's easy to name drop and say, oh, you know, I'm picking up where Ashley left off. You know, last communication was so-and-so, and now we have a new issue, and this is what it is. And you kind of, you lay the foundation, you lay the history, and you open the door to this is what's next. And for us in Minnesota, it seems like it's every couple of years that we need something from Medicaid. And every time I go back to my last contact, and she or he directs me to the new one, because there's someone new.
Right.
So inevitably that, it's getting to the right people. But Dana, you're doing all those things that I would do, just all the same good stuff. So don't hesitate to, bring in AOPA and name drop, but maybe if you could just potentially get a letter from them. It doesn't take a lot of people. Like they're saying, we don't have the bandwidth, we can't do it. Say, great, I'm here. I'm going to do some of this work, and I've got some other people to do it. I just would really like to make sure that our association is good with it. Who isn't going to be good with it? And Nicole and I come from the kill 'em with kindness approach. You come up with, we're here to help. We're doing good work. Can you support it? And how can they say no to that? Right.
Right. And actually, Medicaid has come to us.
Even better.
I was at Beacon, and so our contact there would actually reach out to me and Eddie and ask us questions, and for Medicaid purposes. So that, it is a good relationship.
It's
there.
amazing. Yeah,
Yes.
That's great.
And so I'm not really worried about that, except I've told Sam and Joe this, I'm not a clinician at all,
Me neither.
And so I worry about stepping on those clinician toes a little bit. And that's one reason why I wanted that support, but I can't let that stop me at this point.
And quite honestly, when you get to the point in the conversation that it requires clinic speak, you have to pull a clinician in. So I would definitely make sure you have someone in your network, your right hand. For me, it's Charlie. I always say I'm only half that good, because he completes the sentence, right? I can bring it in, I can talk the policy, I can do the writing, I can make the connections. But when they ask, about coverage criteria for cranial remolding orthosis, I look, I say, okay, Charlie's right here. Let me bring him in the office, or he's already on the line, because I understand that we only get so far. And then they also have just this incredible appreciation for being able to have that clinical conversation, because like the person in charge for us is a PT. So she knows orthotics and prosthetics. So when I bring in Charlie or Kimberly and they talk about specific details, I just sit back, and I can't continue it like they can. So I would definitely recommend that you have someone, you team up with someone, and maybe ask the association if there's someone in their leadership that is willing to be a practitioner that you can work with to take it to the next level, because then that kind of gets them back in. Also, they're going to want their name. They're going to want their name on it. They know that they've worked. It's good stuff. They know that it really brings back. They're supposed to be stewards of the association, which means they really want to make sure that they're continuing that responsibility, even if it's been back burner like we have been in Minnesota. So, I mean, it's hard to criticize that, based on, the pandemic and what happened, and people not getting, and people stopping membership dues, just, we can't afford that. It's the first thing that goes. But, inevitably something is going to come up that needs attention and you'll have to regroup. And they know that. So I don't know, right, Nicole? Just start with that kill them with kindness approach. And
so I'm going to
Yes.
interject a little bit differently. Hi, Terry, it's been a long time. But I was the California Orthotic and Prosthetic Association president for 4.5 years during the time that we passed the parity legislation under Schwarzenegger. And everything that Terry has just said, I'm going to reiterate. You need to maintain contacts. Joe and Devin were invaluable to our efforts at the time. And you do need to have a strong clinician support and spokesperson that is not afraid to go up in front of legislators. So it does need to be somebody that has the capability, ability, and it understands the legislative process. However you find, coerce, handcuff that person to the task is what you need to do. Some of these things are challenges. I think the one thing, and again, you're primarily focusing on Medicaid coverage in some of the states. One of the things that I found and that I'm seeing, because I was very much involved in the implementation of AB 2012, and one of the things that's unique about that piece of legislation is that it was not a mandate to cover O&P services. It was a mandate to offer coverage for every private insurer in the state. Because it was a mandate to offer, the insurance carriers treated us administratively under the DME benefit, but financed us administratively through their medical services benefit, because any O&P services under private insurance in California have to be covered under the same terms and conditions as the major medical benefit. We think it has created a separation legislatively within California between DME and O&P. And the DME Association was very supportive of our efforts because we no longer sabotaged their benefit limitations for the DME benefit. But our key, and the thing that's being looked at in California right now, is the fact that it did create a legislative separation between DME and O&P, and how can the association use that as a lever to further create some separation? There's a number of different strategies that people are talking about. It hasn't quite gone public, but it'll probably start to happen over the next couple of years. And again, it's, my kudos to AOPA. We had the Amputee Coalition assisting us. At the time, John Garamendi was our insurance commissioner. And AOPA was invaluable in the efforts that they extended to assist us. So thank you.
yeah, and I'll add one more thing, for us, Dana, obviously policy forum, when I talk about trifecta, you've got your policy person, you got your practitioner, you got your patient. So, if you've got, I came in when I think Sam was talking about the forum that has been created. But if you've got someone else in your other pocket, who you can say, can you come down to a meeting with me? Can you just be on a Zoom with me? Erin Holm for Wiggle Your Toes. Still this summer was on our call representing the consumers when we had our call with Minnesota Medicaid. We're working with them right now on an upper limb prosthetics policy that we've never had in Minnesota, and our neighboring states don't have either. And a few of the neighboring states now are waiting for Minnesota to come up with something to see if they like it. And it's been a few months, and I'm a little bit nervous to check back with her because she hasn't been. It's a huge, huge, huge feat for her, but she wanted to take it on. So I thought after the first of the year, I'm going to see where she's at if she needs more help. But my point there is, I've got Charlie as the clinician. I've got Erin representing consumers, and together that really rounds out the equation. There has to be a need, right? Which is what Sam explained in the beginning.
Absolutely. And also kind of Emma brought that up in the chat. Kind of data and statistics are always going to be helpful. And if you can have that trifecta with the numbers that that kind of help fill out the argument, then that'll be very helpful as well. And I think that getting more data and statistics for the O&P field will be a priority, and definitely something that we're going to be trying our best to get our hands on in the next year.
Nice.
If nobody else has any priorities, I wanted to do our Advocate of the Month award. This month, our Advocate of the Month will be Ralph. I appreciated your outreach about the policy forum, and this is an opportunity to plug policy forum, as I always love to do. We don't have dates set yet, but we're looking at the kind of congressional calendar that has been recently released over the past week or so, and we're going to try to find a date that really helps us to maximize our legislative advocacy potential. So I hope to see you all there. It's a really good time. I had a lot of fun at this year's back in May, and hope to see you all and have some good meetings with legislators. It'll be a good
So
time.
I'm going to interject on that, as I was booked for the policy forum in May and had to cancel it the day before because I got sick and couldn't travel. So I've got a credit with United that I need to use. So you need to book the date so that I can use the credit.
I know,
Something
yeah.
like
That's good to know. Yeah, we're trying to find something that works for everybody and works for Congress too, because their schedules, it's always a little finicky with them, for sure. But all right, I think that brings us to the end of this month's Advocacy in Action. I hope everybody has a great holiday, and I will hopefully see you all at next month's. That date should be coming out probably early next year once we're all back from the holidays. And Ralph, I'll send you an email after this with your prize.
Thank you,
Thanks.
everybody.
Thanks, everyone.
Thank
Good to see
you.
everyone. Happy
Good to see you all.
holidays.
Yes.